Hello everyone, welcome to another episode of Revsy Care Hub podcast. Please like, share and subscribe to enjoy each episode. I am Nosuke and I remain your anchor. This week's episode on Revsy Care Hub podcast, we shall be talking about peptic ulcer disease. Peptic ulcer disease has become a major cause of concern in our society today as both genders, the young, the middle-aged and elderly, are being affected by this disease condition. Hence, we're here to enlighten and educate us on this topic. Let's go right into it. Peptic ulcer disease are open sores that develop on the inside lining of the stomach and upper portion of the small intestine. We have two types of peptic ulcer disease. We have the gastric ulcer. This type of ulcer occurs inside the stomach, and the duodenal ulcer. This type of ulcer occurs on the upper portion of the small intestine, which is called the duodenum. How does peptic ulcer disease occur? As we all know, the digestive tract is coated with a mucous lining which protects against the stomach acid known as hydrochloric acid from eroding. When this acid comes in contact with the inner surface of the stomach or small intestine, it creates an opening or a sore, and this bleeds, and this is how peptic ulcer disease occurs. What are the causes of peptic ulcer disease? The major cause of peptic ulcer disease is by a bacteria. Normally, this bacteria, which is known as Helicobacter pylori bacteria, commonly lives in the mucous lining and causes no problem, but it can get infected, causing an inflammation which raises the amount of hydrochloric acid in the stomach, causing an ulcer. We should also know that this bacteria has no proven way it can be contacted, but it is said to be contacted through food and water. Another cause of peptic ulcer disease is by the use of certain medication like aspirin and other pain reliefs known as non-steroidal anti-inflammatory drugs. These drugs irritate and inflame the lining of the stomach and small intestine, causing peptic ulcer disease. What are the signs and symptoms of this disease condition? We have one, the burning stomach pain, known as epigastric pain, and this occurs in empty stomach between meals and late at night. Another symptom is bloating and bedridden. We have the nausea, we have vomiting, we have lack of appetite, we have heartburn and even weight loss. What are the diagnoses to show that this disease condition is the problem? One, we have to do a laboratory test known as H. pylori test. This test will detect if this bacteria is positive or negative. Another test that can be done is an endoscopy. This is by the use of a tube-like structure or an endoscope passed through the throat down to the stomach with a camera connected in order to view the lining of the stomach. And then we can also do an X-ray of the gastrointestinal tract. What are the risk factors of those things that can make ulcer worse? Please let's know that these things do not cause ulcer, but can tend to make the condition worse. One, we have smoking. Two, we have alcohol. We have spicy or peppery food, and then stress. Next, we shall be talking about the complications of peptic ulcer disease, or those things that would happen if peptic ulcer disease is not early detected or managed properly. We have internal bleeding. This is due to the bleeding that occurs in the inner lining of stomach due to the sore that has been created. Two, we have perforations. This is due to the boring or hole-like activity that is created by the hydrochloric acid. And then we have obstruction. This is due to the inflammation in the inner lining of the stomach and small intestine. This prevents food from passing from the stomach to the small intestine. And then we have the gastric cancer. How can we prevent ourselves from contacting this peptic ulcer disease? One, we need to protect ourselves from infection, and this is done by washing our hands with soap and water and making sure our foods are properly cooked. Two, by the use of pain relief with caution and prescription. Please let's take note of that. And also, we should try to avoid too much alcohol. This brings us to talking about the treatment of peptic ulcer disease. One is by the use of antibiotics. This is taken when the bacteria H. pylori test has been done and then the bacteria detected to either positive. And then another treatment that can be taken is the use of antacid. This neutralizes hydrochloric acid. You can also make use of protein pump inhibitors. This reduces the stomach acid by blocking the cell that produces it. We can also make use of the H2 blockers, which reduces the amount of hydrochloric acid released into the digestive tract. we should note that whenever we have any of the symptoms, it is very important to visit the doctor in order to get tested and the right prescription given unto us. Please let's not forget to like, share, comment, and subscribe in order to enjoy more episodes on Revsy Care Hub podcast. I remain Nurse Uke. Bye for now.